Many subcomponent projects that they've had to develop and are developing over the years to put that success together is a clinician. Okay. And the evidence is overpowering, and the second most important thing in terms of being successful with the application of information technology in clinical settings is clinician involvement. Comes number two. Okay, so, and then you also need, obviously, technical leadership as well. Okay. But it's the organizational leadership as well. And of course, there's various aspects of leadership, okay? Vision, sharing values, having courage, being pragmatic, okay? Secret to any successful relationship: communicate, someone. Create an environment for change. Not always easy to do, but part of being successful. Establish solid governance structures. Okay, you heard a lot about governance today, and it is very important. And good leaders develop good governance structures. And they just don't say it's going to be done necessarily this way. They develop the infrastructure, including governance, to make it happen. Commit to resourcing and incentives. Commit to process improvement and quality. Adapt legislation. I mean, I was telling someone, who was I talking to as we were walking to the cafeteria? Yeah, Randy. For many years, and you'll hear from the Danish, because we haven't talked about the Danish because it was a separate little session on it, that since the mid-1990s, they've been transmitting prescriptions from the GP's office to the pharmacy. Mid to late 1990s. They've been doing it a long time. But they were not able to capture that message as it went over the wire and save it. All they could do was send a message, read it, and then fire back another message that said, we've dispensed the drug. So it wasn't until about 3 or 4 years ago that they started to say, they wanted to do it for a long time, but they couldn't. They have a medication profile so that by confirming it, the physician could see all the medications the patient has been dispensed. Not taken, but dispensed. They couldn't because they were not allowed to by law to capture that data. The law did not allow them to capture that data. So they changed the legislation. Okay? So they had the leadership to change the legislation. And now they have a medication profile, and they have all the benefits of knowing, particularly in emergency departments, what medications the patient is on at the time they're being treated. Pragmatic priority setting in patients, okay? We didn't hear that too much, but a lot of this morning, but a lot of this takes time. And the Danes got started, really got rolling. They got started in the early 90s. And they've achieved this point of leadership over the years. They've been at it a long time. It took the VA over 10 years to turn their organization around, including their clinical information system. And these things take time. Other important achievement keys: clinician involvement. There's no doubt that another very important part, and sometimes easy to sort of put aside, but it is important that the infrastructure be solid. The early days of technology, still to a certain extent, are nothing like we used to have. When we started introducing systems seriously in the 90s, was the unreliability of the system. The system went down too often. Response time was terrible. And there's no doubt that both of those things can kill any kind of system. So there's a technical element to that. Good project management is so important. Having the right kind of healthcare professionals. And you'll hear some stories about the VA as to how the VA integrates their health informatics professionals into all their projects. So they're sort of an integral part of the project, and they're there for constant support. Standards, performance measurement, privacy, and patient involvement. And then, as I gave you a hint already, is an emerging realization that there's some kind of single organization or entity. In Denmark, it was, less so now because we're now evolving beyond. But, the organization of MedCom was clearly the single entity that brought all this together and made this happen. In New Zealand, and MedCom is a sort of a crown corporation kind of company. It's wholly owned by the government, but it's outside of the government. It's not in the mainstream of the government, so they have some freedom. They govern the government. It was interesting to listen to Roger talk about the benefits of being inside the WHRA, WRHA, as opposed to being in a separate organization. In New Zealand, a private company was the unifying force. In Scotland, Department of Health. So it doesn't necessarily have to be a government agency, but clearly in Sweden, they don't have a unifying force. You ask them, who's responsible to institute change, and who's to implement policy, and who's responsible to move this agenda forward? There isn't any. But they don't have, and you saw in the other countries, there's no national strategy, there's no national organization, national institute. Okay, so closing comment, and then we're going to have a special demonstration. Champions manage to improvement, but it depends on top-level organizational leaders. Create leads to a caution ability to accept change. And this agenda is all about change. You heard Dick talk about that in Rush today. It's about change, about changing the way we've been doing things, the way we are doing things. We heard from our good docs in the back there who told us that that's one of the big factors as to why things are improved now than they used to be, because of the way of change we're being changed. Plus the technology.
I didn't hear that. I didn't hear it.
Okay, so that finishes that, and I rushed through a little bit because now we're going to have a treat. You've been hearing about Alberta. You know Alberta is ahead of the game. And Glenn wisely suggested, why don't we go and take James, I'm sorry. Sorry, James. Glenn, put that sign in front of you. So James is going to show you, as a physician, what Medicare does. Okay, and it's probably the most advanced system we have in Canada right now.
Yeah, I want to do this, but I don't actually have my DVI to VGA adapter that you do with Mac. I have a DVI to VGA adapter, and I'll have to see your laptop. Okay.
Can you access the system through this?
Yeah.
Is that this?
No,
You're
it would be a different one. No,
Oh,
no.
Never mind, I'll just use it. It should work. If you've got it. I shouldn't do it. This isn't a secure network. So let me do it through.
Well, I gotta get through to the net first.
Yeah.
And then you can go to
I'm just saying, this isn't a secure network.
No, I realize, but you can't get to anybody there until I get on first.
Right. I know that. There's a different network you can use.
What, here? You can get to the internet without calling us from the
Well, sort of.
go for it.
No, you could, you have to use different, and we'll use this.
Okay, no, hang on, I didn't finish.
We didn't finish. I have my adapter, it's in my.
So, just to your point about technology, Dr. Protti, then, do you think it's really technology then that's making the advances in the adoption of our things, or organizational change
No, we were just debating the impact of technology on the reduction of hospital beds.
Yeah. And I still don't think it's technology. I still think it's just like this, it's organizational change. It's,
See, my argument, I guess, is technology has allowed physicians to carry out procedures which require patients to stay in hospital for several days afterwards. And I don't think it's got anything to do with the fact, well,
I'll show you papers that tell you differently.
non-invasive procedures, drugs, including drug issues.
That's not technology, that's just better administration.
No, it's technology. It's not, drugs are
The law hasn't changed. OxyContin, Oxy-IR,
Well,
those drugs
there
are.
are new drugs that allow people to be treated with this.
Surgery?
No, not really.
No, okay.
I can go in for a lot, or I can go in and have, my kidneys done through into day surgery versus,
Which is
Yeah, there's some
technology.
isolated examples, but across, if you want to take a large section of what we do, right, a big chunk of it is simply just because we do it differently. We do it better.
And,
We treat patients differently, that's all.
I'm not arguing that, we're arguing something which technology is.
Yeah, but if you said technology is the number one cause of why we can use less beds and get patients out quicker, I would say it's not. I'd say it's number 2 reason.
drive.
Much better nursing care. So the key is you get people on your side, so I draw in nursing on my side.
That's right, exactly.
Sorry, it's making me put something else on here. The Citrix presentation server client.
And
Sorry.
the tech people in the
It
room?
would have been faster if I had the display.
Do you want to use my regional laptop?
I don't care. It doesn't matter what
Well, I
laptop.
don't know if it'll let you do that, but the Citrix
Well,
client.
this is- okay.
I used to have a Citrix client on my old computer.
Back in my room.
It was standard to your demonstrating. So that one thing on this.
Anyway, sorry if I thought I was going to do this, I would have brought it with me.
You're not gonna ruin Dennis' computer, are you?
Am I going to take over his
You're not gonna
computer?
put something on it?
Oh, I'm going to put stuff on it. Well, the brief,
So put Glenn's name.
the brief synopsis of, hopefully I can get this thing to work, but the brief synopsis is, I mean, you've heard lots about Medcare. It's a portal that gives us access to more or less everything on our patients. Okay, looks like you're successful. Okay, there we go. Okay, so this gets me into Medcare. That's it, all that. So then there's a couple of different modules to it. The main one that we use is called Medcare, and it gives us basically everything. It allows you access into. Okay, so this is the real Medcare, but since if I log into this, you're just going to see all of my patients and their information. And I'm probably not supposed to show you that. I'm going to go to the learning environment so we can go into a safe place and you won't see anything that will offend your tender sensibilities. Okay, so this is a little training environment. So I think it only gives me access to one thing. And in this one, it pretends I'm coming from some drugstore. I can log into this as a clinician or a pharmacist or whatever to practice doing whatever it is that I do with it. So this is the basic layout that you're going to get no matter what your format is. In the view that I have set up when I'm using it in the office or when I'm using it on my computer or whatever, this screen you can configure the home screen to be whatever you want. So I have it pop up with my patients, so any of my patients that are in hospital on the top, and then I have a list of all of my other partners, so all the other general surgeons at the Denis Protti Hospital, and all of our patients will show up in the list below that. And I can click on any patient's name, and it'll take me to their individual file.
These all active patients? or
These are all the active, you can set it up, you can be inpatients, outpatients, I can't remember what the other option is, but those are the main ones.
They're just filtered.
And they're just filtered, it searches, I have it set up to search, to find them by me as their care provider, as the responsible or the consulting physician for them. So anything that I'm responsible or actively